Boom. The ball is snapped and handed off to the running back. It is a sweep to the left. And then boom again. The running back gets hit and is not getting up. This happens almost every Sunday in the NFL. Chronic traumatic encephalopathy, or better known as CTE, is a brain condition usually found in professional athletes, from basketball players, football players, soccer players, and it is even found in military veterans. This is important because it is a condition that can only be diagnosed until an autopsy is made after someone has passed. I myself have suffered from 3 concussions throughout my high school football career, and not many know about CTE, but it is a topic that is not only important for athletes, but like I said, also for those interested in the military. First, I will be talking about what we know about CTE, a little bit of the history behind it, and then I will proceed to talk about how someone can be diagnosed with CTE, and then I will finally talk about an example of an NFL player who was diagnosed with CTE, and some of the preventative measures that high schools and the NFL takes to this day to protect their players. CTE has actually been around for almost a century, but have you ever heard of it? CTE was described for the first time in 1928 by Dr. Martland as the punch-drunk syndrome. It first noticed in boxers. According to the Concussion Foundation, in the 75 years that followed, only 50 cases were confirmed. In 2005, CTE was first diagnosed in a football player for the Pittsburgh Steelers, Mike Webster. The Brain Bank donated more than 600 brains to the bank after this, to the cause after this, and 360 of them were diagnosed with CTE. Unfortunately, we will never know if we have CTE until it is a little too late. CTE is diagnosed by doing an analysis of the brain tissue after someone has passed. The process is not part of a normal autopsy, and until recently, only a small number of doctors were actually able to do this process. In 2015, a criteria was made by the National Institute of Health to help neuropathologists diagnose someone with CTE. According to the Chronic Traumatic Encephalopathy article written by Armand Fesheratsky, patients usually suffer from memory loss, executive functioning deficits, visual spatial dysfunction, and in stage 4 they usually present symptoms of language deficits, psychotic symptoms, including paranoia, motor deficits, and Parkinsonism. Motor deficits can include paralysis and muscle stiffness, and Parkinsonism includes tremors, slow movement, and it also includes muscle stiffness. But who has had CTE? Aaron Hernandez was a tight end for the New England Patriots, and after signing the biggest contract of his career, he was convicted of murder. Aaron Hernandez hung himself in prison in 2017, and after his death, he was diagnosed with CTE at the age of 27. In an article written by Adam Kilgore from the Washington Post, Adam Hernandez suffered the most severe case of chronic traumatic encephalopathy ever discovered in a person his age. The damage would have significantly affected his decision-making, judgment, cognition, researchers at the Boston University revealed. There is no way to completely prevent these injuries from happening in a high-contact sport, but the NFL does take some preventative measures. They do provide the players with pads and required helmets. They also require a return to game protocol, which is a 2-week, not suspension, but a 2-week non-contact time for the player, where they rest and they take their time to heal back to their playing position. During this time, they do take some tests to make sure that they are showing progress in their recovery. And to finish up, I hope that you know a little bit more about CTE. I first talked to you about the background and a little bit of the history behind CTE. I proceeded to speak about how someone can be diagnosed with CTE, and I finally talked about the example of Aaron Hernandez and his diagnosis. I also gave you a little bit of information about the preventative measures that athletes are provided with in the NFL, and this also does apply to high school football. Some think that just because they did suffer from a concussion, this means that they will have CTE, but it is usually found in professional athletes because of all the years of experience and the multiple trauma that has been happening from 10 years of them playing this sport. And the running back did get up. He's seeing a little bit of stars, but he is ready and going back to play. Thank you.